Hello and welcome into this video. Did you all know that men are possibly the cause for us women having BV? Now, all of this is alleged, guys, for entertainment purposes as well as educational. So if you stick around with me, you will find out in the video the reason why we basically possibly get BV from men. And there's other reasons as well. Let's jump in.
BV,
So it's bacterial vaginosis.
bacterial vaginosis.
Do you know about bacterial vaginosis?
Yeah.
So what is bacterial vaginosis?
That is when
Yeah. It's an overgrowth of bacteria inside of your ecosystem. And essentially it creates this odor where it's like very fishy.
the fish.
Fishy odor, very pungent. Yeah, it's very pungent.
Yeah.
You walk in, it can knock you out. Like you sit down and like the air rise before
Yeah.
you can. Yeah, it's intense. And it's very common. It's very
So
common.
that's
could lead to a
something that-
discharge.
Yes.
Yeah.
It's like a gray milky discharge
yeah.
that happens.
Now, I want to say one thing. That is like a really, really bad BV because I personally have had them. Most women have. It's nothing to be embarrassed about, but most of us are if it's that bad. But it has to be really bad and you have to let it go for a while for it to be like where everyone can smell it for the most part. Usually, if it's BV and it's a mild one, you will smell it, but someone else won't. But if you have sexual intercourse, then you definitely will smell it more at that point.
When you have bacterial vaginosis.
That we're gonna say that leaks from the vaginal canal.
Okay.
You see what I'm saying? Outside
on.
the vaginal opening.
Okay.
You know.
So how you feel about, because like most people learn about all of this stuff through music. So it's been like kind of shamed, like fish. The fish thing has become a popular lyric
Yeah.
for men to describe
Yeah.
women, like, you know, like, or smell like fish, whatever.
Mm-hmm.
What level of psychological shame do you think that plays because it has such a stigma, especially the fish thing? That's been
Yeah, that's
from
been since
30
middle
years ago all
school.
the
People
way
talk
up.
about you. Yeah, as a kid, like that's a thing.
That's
like,
been a thing for
that's
decades.
been a thing.
Is it like an education of like, look, this is what this is. This might not be something. This is something that you need to, you know, get attention for. It's not like something that's wrong with you.
Yeah.
Like, talk about that, because some people might just think like something's wrong with me. Like, you know,
Yeah.
like
My community, they call me Mama Salt. And the reason why they call me that is because I am very nurturing to my community. I talk to them with love. I don't shame them. And I think that they love that because sometimes you'll be promoting a product and it's like, ooh, if it stank, then it's like, hold on. Like, this is a very sensitive topic for me. And this is something I've been dealing with silently, something that I didn't want to tell anybody. So when I'm trying to learn about a new product, I want to be able to soften the blow. So I soften the blow with them with education. I soften the blow with telling them about me. You know, sometimes you got to tell a little bit about you so people can open up. And with the whole fish thing, yeah, it's funny. Haha. But at the end of the day, you might be crying on the inside. So,
yeah.
you know, it's tough. So I try to educate them as much as possible, not just about the product itself, but about your water intake, your diet. What are you using? Are you peeing after sex? Like, are you taking probiotics? Are you making sure that,
pineapple.
yes, like
Does that work?
well, I wouldn't say pineapple is the end all be all, but you need to have a really good probiotic. And so some probiotics have pineapple in it, but that whole like eat the pineapple tastes better. If you have BV,
It ain't gonna.
it ain't gonna do nothing. That
That's
BV gonna
pineapple ain't
permeate
gonna do
through. It'll permeate through for
Yeah.
sure.
Partner smells like fish. Your bait and tackle are probably playing a part in it. See, there are several kinds of bacteria that can actually live in the urethra itself or on the outside penile skin. And this does not matter if you are rocking a hoodie or not. The bacteria can live on both. During certain spelunking activities, these bacteria can then be transferred to the vulva and the vagina, and there they will begin to multiply. You can actually increase the odds of this if you decide to cream fill that pelvic pie, because semen actually changes the pH of the vagina from acidic to a more alkaline, and this allows the bacteria to get a foothold. So now, through a bit of bad hygiene and irresponsible fluid placement, you have turned one of the best water parks on Earth into a stinky fish pond. What we're talking about here is something known as bacterial vaginosis, and the thing is, in males, it doesn't really produce a lot of symptoms, especially the smell. At worst, you might get a bit of rash or redness around the glands of the penis, or the urethra itself might become
Not it
inflamed.
having
But
eyes.
once that magic wand transfers it to the vagina, kind of all hell breaks loose. It can produce an extremely foul, fishy smelling odor and begin causing irritation and even inflammation into the pelvic cavity. The cool part here is that it's completely treatable with a course of antibiotics. The hitch is you both have to go get treatment. And if either one of you don't know what type of wood monogamy is, meaning that you have more than one partner, they have to be informed and do treatment as well. Otherwise, it's going to turn into a very odd circle of you chasing and transferring this bacteria amongst yourselves. And there's actually a very easy way to keep yourself from picking this up and spreading it from partner to partner. You simply wrap it up before you slap it up. And the next time somebody says one of these won't fit, you will know
Wrap it up
that's baloney. It'll fit.
before you slap it
Hey,
up.
this is Dr. Jackie, and 5 things you need to know about bacterial vaginosis. Number 1, it can come with a fishy odor, especially after sex. Number 2, it is most common when you have multiple sexual partners. Number 3, it is more common when you have lots of oral sex because the bacteria in the mouth can create an unstable environment in the vagina. Number 4.
I'll pause right there briefly. I learned something, and something that I saw, they were saying that if you choose to do, that what she was just talking about, you should rinse your mouth first, with like a mouthwash that maybe won't, like a little bit before that, and then kind of do whatever you do. It's supposed to help a little bit the germs, but I don't know. So don't take my word for it. Just saying, tip.
It has to be treated by professionals. You need an antibiotic prescription. And number 5, it is more common in women ages 15 to 44. Those are 5 things you need to know about bacterial vaginosis.
BV is one of the biggest complaints that my patients have, and despite doing everything that they're supposed to, taking the medications, making the lifestyle changes, they still get recurrent symptoms. And it turns out we may just need to be treating their male partner. The study was just published in the New England Journal of Medicine talking about treating the male partner when it comes to the female partner's recurrent BV. And they actually had to stop the study early because they found there was such a big difference in the 2 treatment groups. Now, the study design was super simple. They found 164 couples where the female partner had BV, and they basically split them in half, where half got the traditional treatment of just the female patient getting treatment, and then the other half having also the male partner receive treatment. What they found when they looked at patients who then had recurrent BV infections is that those who did not have their partner get treated had a much higher number of recurrence than the people who did have their partner be treated. So
Makes sense.
63% of patients who didn't have their partner treated had a recurrence of the BV versus only 35% of those who had their partner also treated. Now, please be patient with us as we digest this new information. Standards of care are constantly changing when we gain new information through studies like this. So not every doctor is going to automatically treat your partner, but I think this is a great step forward in understanding this very complicated and confusing and frustrating disease for patients.
Is bacterial vaginosis sexually transmitted?
So there's a lot of questions about that, and bacterial vaginosis is not considered a sexually transmitted infection. Bacterial vaginosis is a diagnosis where there's a bacterial overgrowth in the vagina, and that can happen for a lot of reasons, but usually it's because there's been a recent change in the vaginal acid level, or pH. And that can happen because of excessive sex, and so that's why people often think, oh, well, maybe it's sexually transmitted. The semen will alter the vaginal acid level. Vaginal acid level is usually around 4. Semen has an acid level around 7. So if you have a lot of semen around, then it can cause a change in the vaginal acid level. Other things that can cause a change would be antibiotics. They kill off the lactobacillus in the vagina, which causes the acid level to rise. Lactobacillus makes the acid level around 4. So if you kill all that off, your acid level will change, and the bacteria will overgrow. If you've been exposed to steroids, that could cause it. If you are just generally not feeling well, then you can develop a bacterial vaginosis infection because your body's immune system is focused on something else. So there's many reasons why you can have a change in the vaginal acid level. Diabetes is another one, for example. If you have very high levels of sugar in your blood, then that can cause the sugar in the vaginal secretions to rise, and then bacteria will eat that up and cause the infection to grow. So again, bacterial vaginosis, not an STD, but is something that can develop after a lot of sex. So you want to make sure that you monitor for things that could change the vaginal acid level and work on trying to promote vaginal acid to be back to its normal state, like probiotics, for example, or boric acid suppositories.
So I heard you're tired of recurrent bacterial vaginosis. I heard that you're tired of going to the doctor and getting the medicine and taking it, and after 2 months you come back. I heard that you want natural remedies to help you heal yourself from the inside out because you're tired of that smell. You're tired of the itching. You're tired of the discharge. But I got something for you. Let me give you some remedies. As a female who studies the female anatomy and also a person who believes in herbs and study herbal medicine, let me help you with a few tips that can help you get rid of that bacterial vaginosis for good. Number one, get you a good probiotic. It's very important that people with vaginas take probiotic for your vaginal wellness. So make sure you take a probiotic. You can check in my showcase. You will see a few choices that I laid out there for you. Okay? Start taking a probiotic. Garlic. Garlic has antibacterial properties. Garlic can fight bacteria just as the bacterial infection, just as the antibiotics the doctor will give you. Here's how you're going to do your garlic. Get you a clove of garlic or get you a couple cloves of garlic, mince it up and soak it in some coconut oil. Soak it in some coconut oil overnight. And as you soak it in the coconut oil, next day it's gonna activate. So you activate the antibacterial properties in it, and then you're gonna take it. I'm not telling you to put no garlic up in there, okay? That you will burn, right? Take the garlic internally. Take it through your mouth. And the garlic will do the job just as the antibiotic the doctor will give to you with fewer side effects. Or if you can't take the garlic, the garlic don't make you feel good, get you the supplement. Take you from about 1,000 milligrams of garlic per day, one soft gel per day. This right here is going to help to kill any bacteria, the bad bacteria, get rid of the bad bacteria. But if you want quick relief, I would suggest you use the garlic straight up, the fresh garlic. The next one I recommend is tea tree oil. Tea tree oil has antifungal and antibacterial properties, making it super good for treating BV. You can take tea tree oil, mix it with coconut oil. You can use almond oil or you can use castor oil. You can any oil that is good and safe for you, that you're not irritated by. Take that tea tree oil and dilute it in that oil. You can apply it outside, or you can do the same way I showed you how to do the yeast to treat your yeast. You can apply that on your liner outside, and you can make it and freeze it. When it gets hard, use it as a suppository. Another herb you can use is echinacea. It's used to fight inflammation and also kill bacteria. You can use neem oil. Neem oil kills bacteria. You can use golden seal. Golden seal is amazing. You can take that. You can take it in the pill form. You can also take lavender oil. Lavender oil works magic as fighting infection. You can take a bath, drop you a couple drops of lavender oil in there and sit in it. So there's so many things that you can do that can knock that BV out and prevent it from reoccurring. Just choose one. Watch the video right out to the end and choose one that works great for you. I hope that helped. I'll catch y'all later.
Now, this was a brand that I did purchase for a while there because I did have issues a while ago. Now, that one says, yeast, but they have one for BV. Now, I don't know if they still sell it because, again, this was some years ago when I did need to use it. And so yeah, and not to say that, sometimes you can have the one partner and you can still have BV because of what the gentleman was saying. And you're not knowing that and them learning things of that, you're passing it back and forth, you don't know. But again, this was years ago and I've been with the same partner for years. But that's neither here or there. So again, I did not know, again, that men are the main cause, but obviously, as you heard, the one lady and the other people were saying that there are other issues as well, but mainly it can be because of your husband, boyfriend, or relationships that you're having with different men. So yeah, leave me some comments, guys, and let me know. Did you even know about this? Because I didn't. And that's if you guys are even still here with me. But yeah, leave me some comments and I will call you guys back.